Hi there, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. And Julie, it appears that cases seem to be going up in town. Am I reading that right?
Yeah, numbers are starting to go up. It's not campus numbers. These are community transmitted cases. So yeah, we are seeing an uptick.
Do you have current numbers right now of hospitalizations and deaths and infections?
Yeah, and that's really what should be more concerning to people is that we are seeing, because of the variants, we're seeing more hospitalizations and also more serious cases in younger people. So right now we have 399 active cases. Those are people in isolation, 442 people who are in quarantine. We have 12 hospitalized right now from Champaign County. And we have had, unfortunately, another death, and we're up to 139 deaths in our county. Our current positivity rate is about 3.6. Peoria, just as a note, they're up to about 12%. I guess they made the New York Times for like the ninth highest, rising numbers in the country. Currently, we have about 55,600 vaccinated. That's 32.18% of those eligible, so 16 and above. And we've given a total of 131,297 vaccines. We still have a long way to go. People need to still keep trying to get the vaccines, and don't give up on that. There's going to be more and more vaccine in the community, so make sure that you're trying to get it as soon as possible.
I ran into a local Walgreens and there were people lined up along the wall.
Mhm.
Is there a vaccine shortage in this community, or if people want them, it's easier to get signed up right now?
Well, it is easier to get signed up right now, but there's not really a shortage. What it is that Champaign County still has more demand than we do supply. A lot of the other counties, unfortunately, are starting to see more supply than demand. So we are getting more vaccine in from other areas. Rather than them getting it, we'll start to get it. So we will have more. But, they need to keep the demand up as well. So they need to get a high number of their populations vaccinated, and some places just aren't. So we have to, keep after it, make it as convenient as we can for people, and just hope that we can get everybody vaccinated as quickly as possible.
And 16 and up is eligible right now, correct?
16 and up. Now with 16 and 17-year-olds, they have to have Pfizer. So you need to, the place to get that right now is at Carl's North End Clinic up there by the mall. So the Kohl's Dress Barn location is where the Pfizer is right now.
And what I read this week is that Pfizer is in emergency use. They applied for it for 11 to 15. Is that correct?
12 to 15. Mm-hmm.
Okay, so how long does that process take for those of us with 12 to 15-year-olds?
It should be within the month. It doesn't take long. It takes usually about a month from the time that they apply for it and they have all their data. Then the data has to be reviewed. Then it has to go through, the immunization practice group. And then once it's approved, then we will be able to just raise those, lower the number to 12 and up. We'll be able to get Pfizer. So once we get to a point like that, we'll start working with the schools and trying to make that as convenient as possible for people who want that.
The younger kids are not the ones that keep showing up in the ER. Americans ages 18 to 64 have seen an increasing number of emergency department visits. I'm in that category. Is it pandemic fatigue? Was it a spring break spike? To what do we attribute this spike?
Well, I think what we're seeing right now with the younger cases being hospitalized is likely due to the variant. So it is way more infectious. So it's a combination of things. The variant B117 is very infectious, 70% more infectious. It's also showing more serious cases in younger individuals. So while we got, most of, and not all of, our seniors vaccinated, we're up to 78.74% of our seniors vaccinated right now in our county, but that still leaves around over 5,000 very vulnerable people should they get this. And then the new variant is, although anyone could have gotten sick and had a bad outcome, statistically, it was always the older individuals. But this is definitely showing up in younger people as well as evidenced by hospitalizations and deaths. I mean, Vermilion County just had a woman in her 30s this weekend showed up in the paper as having died from this. So, it's still very serious. And the other thing that's attributing to the spike in the numbers is what you're alluding to. It's like the fatigue or I'm sick of this. And so I'm just going to act like I am vaccinated. That is not going to work. But what will work is getting vaccinated. And then you will be able to do things safely, a lot more things safely. So you can't just be bored with it and hope that somebody else's vaccine is going to prevent you, because we are so far away from that. So people need to protect themselves with their vaccine.
Julie, I realize that you are not an elected official, nor are you the governor of a state. However, I look to the west and I look at Iowa, I look to the east, I look at Indiana, and I look south to Missouri, and they are all dropping mask mandates. Why is this happening now? And do they know something that you and I don't?
Well, yeah, honestly, I will be surprised if it looks any different, because, the fact is a lot of them weren't doing it anyway, right? So I think that the ones who understand the science are going to continue doing it. The ones who haven't been vaccinated and are concerned about it are going to keep doing it, and yeah, I don't think it's a good idea at all. We need look no further than other countries, or look at the positivity rates of the states not the positivity rates, but how many people have been infected based on their population. And you'll see that the mask wearing does work, and the distancing. And we are so close, to getting everyone vaccinated who wants it, that it's just, to me, extremely tragic that people are letting down their guard way too early. They need to get vaccinated first and then start getting back to some normalcy.
I'm glad you brought up other countries, because there's been talk of vaccine passports. Some other countries require it if you come into their country. In the United States, some governors have suggested maybe we need them state to state. And I know that it's a personal thing, it's a policy thing. You and I can't decide that for the country, but what do you feel about that?
I honestly don't even know how it would work. I think it would be so incredibly hard, to have it from state to state. Will there be places that say you can come in here if you're vaccinated? Yes, businesses will be able to do that if they choose to do that. I don't know how it would work so much from state to state. Certainly traveling to another country, that's a whole nother thing. If they say you need to have it to get in here, you're going to need to have it to get in here. That's how that works. And same thing with us telling other people that they need certain things to come to our country. So that will work. How the vaccine passports will work, I don't know. But it is, there are going to be places strongly encouraging it, because people places want to get back to normal. So, if you had an entire, whatever it was, office or whatever, and everybody's vaccinated, you're not having to sit around and wear masks around each other. So, there are obvious advantages to doing that. So I think that there are going to be places that will do it. I just am not sure how it would work between states, because you have to drive back and forth. But I think that some of the southern states are saying you can't have vaccine passports in our state at all, private businesses, but we'll see how that works out. That's going to have to wheedle its way through the courts. But I am encouraged somewhat in finding out that when Texas did away with their mask mandate, that a lot of the places are still keeping them, and a lot of people are still using the masks. So I think that there are a lot of people who understand this.
This past weekend, a friend of mine and her family of 6 here in Urbana went back to church, in-person church. They had 25 people at a time. You sign up for a slot, you wear a mask, you socially distance. They're still singing though, even with masks on. Is all of this safe? That just feels like it's kind of a menu of what's okay and what's not.
Well, if you are, first of all, if you're vaccinated, you can do a lot more, obviously. I keep saying that. But if you, depending on how large the church is or the area they're going into, you can do a lot of things safely if you're masked and distanced. So if they are singing, they would need to be distanced, obviously, a lot more. It sounds like they're only letting in a small amount. So it's possible to do that thing. But unless you're vaccinated, there is nothing right now that's safer than it was, let's say, to do in November. There's nothing safer at all. If you're not vaccinated, you're at as much risk as you ever were, only now maybe even more so because of the variant that is so infectious.
Summer's coming up and people are planning the end of school in 5 weeks. Can we fly? Can we safely stay at a hotel? Are gas stations along a road trip safe? Like, what
Are you vaccinated?
is that?
If you're vaccinated, you can do all of those things. If you're not, you have to continue. Yeah, you have to continue the same practices. Would I fly if I wasn't vaccinated? I wouldn't. I just wouldn't. Some people have chosen to, and some people have gotten infected. It's the whole process of traveling through airports and on airplanes and things that is inherently going to be more dangerous right now if you're not vaccinated. But hotel rooms, you can do that. You can do that safely. I always use the example that even during the winter time, I had to go to a hotel at one point. I never even saw a person on my entire trip. I did everything through the app. They somehow magically make your phone open the door of the hotel. You go in there, you pay there. I never saw anyone. So you can do that. And they, have the rooms cleaned and they leave them a certain amount of time in between people. They're supposed to do that anyway. That was a lot easier when no one was traveling. Let's see how it works when, there's a lot more people using hotels.
Before I let you go, can you talk about the mindset of the hopelessness before you were vaccinated and the anxiety of it, and how, if anybody's on the fence, how that's really changed in your mind now that you're vaccinated, how you can kind of see a light at the end of the tunnel?
Yeah, I mean, it's a great thing because once you're vaccinated, you're not having to, well, two things. You're not having to worry about getting it, but you're also not having to worry about passing it on to someone. Because that's a scary thing, that you could pass something on that could end up, ending someone's life. To me, that is just very scary. And when it's such a simple thing that we have right now, and we do have enough vaccines, so it's not like there is, some great shortage. You may have to wait a little bit, but keep trying, to get it, because it just is a much better feeling. And that's why everybody's like, can I do this? Can I do this? My first question is, are you vaccinated? Because if you're not vaccinated, you are absolutely no safer from COVID than you were last year.
I'm going to make a t-shirt that says, are you vaccinated? And just have you hand them out.
There you go. Are you vaccinated? Then shoo.
Well, one day I will go back to hugging people, but in the meantime, I will ask them, are you vaccinated? That will be my mantra. Mm-hmm. I know Jason Liggett's working on his. He's our amazing producer with the City of Urbana, UPTV. Of course, Urbana Mayor Diane Marlin, she's vaccinated because, well, she's a public official and she also knows what's best and she listens to science. We all listen to Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, thank you for continuing to do these segments with me.